Hello everyone, it's so nice to have this lesson with you all. This section will talk about the pathology and clinical manifestation of lung abscess. So before the class, a brief introduction of myself. I'm Wei Wang, a physician of respiratory and critical care medicine, the first hospital of China Medical University. So in this section, we'll talk about the pathology of lung abscess first. For the pathology of lung abscess, it includes 4 parts. At the beginning, it's just an infection, bronchioles blocked by infectious clot, and then abscess formation. Small vessels embolized, suppurate, necrotize, and then cause abscess. After that, liquefied tissues break into bronchioles and be expectorate, left a cavity with liquid level. This is cavity formation. In the end, there are complications such as emphysema, pneumothorax, bronchopleural fistula. This is the whole pathology of lung abscess. So what are the clinical manifestations of this disease? First, symptoms. For this disease, the onset could be gradual or acute. Usually, the patients have fever with shiver, cough with a few smell sputum. Also, some of the patients have night sweat, hemoptysis. So we could see from this bottle. In this bottle is the sputum. It is yellow with full smell. This is a typical secretion of lung abscess. Also, some of the patients have dyspnea, chest pain, and even fatigue, loss of appetite. The signs of lung abscess are related to the size of abscess. It can change very much. For example, at the early stage of lung abscess, we could see no sign. It's very normal. With the development of this disease, the signs could be shown because of the complications, such as pleural effusion, lung consolidation. So the related signs could be shown. And clubbed fingers or toes are very typical in chronic cases. From this picture, we could see that this is very typical clubbed fingers. And from this picture, we could see that there's a gap between the nails. This is also the characteristics of clubbed fingers. Laboratory findings of lung abscess include so much. First, we could do blood routine examination. For this disease, the white blood cell and neutrophils increase usually. Also, raised infection markers could be seen in this disease. For example, ESR, CRP, and PCT. They are usually used for this bacterial infection. Examination of sputum is very common for respiratory disease. The sputum could be smeared or cultured. From that, we could see the bacteria or other pathogen. Bronchoscopy could be used for this patient because with this, we could do some transtracheal or transbronchial aspiration. Also, we could exclude obstructive lesion or drainage. Chest image can give us some clue for the diagnosis of lung abscess. For aspiration abscess, the lesion usually occurs in the right side, unilated and single, depends on patient's position. If the patient is in sitting position, posterior basal segment of lower lobe is usually seen for lung abscess. The typical manifestation of the chest image of aspiration abscess is air liquid playing in the cavity. This is X-ray of early stage lung abscess. Here, we could see that in the upper part of the right part, This is the X-ray of early stage lung abscess. In the right part, the upper lobe shows patchy infiltration. After that, we could see the very clear cavity. We could see here, in the right side, there's a very clear cavity. Inside the cavity, there is air fluid plane. This is lung abscess formation. So this is very typical chest images from X-ray and CT scans. From the top two, we could see the cavity. Inside the cavity, there is air fluid plane here too. And the lower, these two, the bottom two are CT scan. It can be more clear to see the cavity with air fluid plane, and also here. So if we could see this kind of manifestation in X-ray or CT scan, we could know maybe this patient have lung abscess. That's for aspiration lung abscess, but there is difference between hematogenous lung abscess from aspiration lung abscess. For this kind of lung abscess, the lesions are multiple, bilateral, peripheral, and small patchy or spherical shadow with cavity or air fluid plane. So from this X-ray, we could see that there is difference from aspiration lung abscess. There are many small lung abscess here. In CT scan, we could see more clear. This is a patient, female, 21 years old, HIV patient. So from CT scan, we could see more clear. Here, we could see many small cavities with air fluid liquid plane. Here too. This is a patient, female, 21 years old, HIV patient. She has intravenous drug use. She is an intravenous drug user. This time, she got fever, chest pain, hemoptysis 1 week, and blood culture found that Staphylococcus aureus. Also, she had complications, endocarditis. So this is very typical lung abscess. It's hematogenous lung abscess. So that's all for pathogen and clinical manifestations of lung abscess. So much for this section. We'll continue later.